Hi guys, welcome or welcome back to my channel. This is Sagnick Dutta. I'm a final year MBBS student at Bardwan Medical College and Hospital, West Bengal. In this video, I want to talk about another subject of third year of MBBS, and that is community medicine, which is also known as preventive and social medicine. As the name suggests, it could have been really better for us as medical students if we could have prevented the subject, but nonetheless, we do not have an option. We need to study the subject, but this is that particular subject in entirety of MBBS which every particular medical student actually hates. And the reason is simple, because there's not much of medicine in the subjects. Rather, it's all about mugging up, it's all about strategies, it's all about just knowing things and not understanding them. So if we really need to pass these exams, we need to have a good strategy. In this entirety of MBBS, there are certain subjects which I like and love, and we really don't find difficult to study them. And there are some subjects which are hard, but we still find out some ways to solve them. But this is one particular subject which do not have a basis in its practicality, because there's nothing much practical about this subject which you read. It is more of an information rather than medicine in itself. So we need to devise a very precise strategy to actually solve this entire subject. In this video, we'll be discussing everything about that. This entire video is divided into a few sections. In the first section, I'll be talking about the resources, the books, the video lectures, the subsidiary books which you can use. In the second section, I'll be talking about the most important topics which you should read. And in the third section, I would like to give some time into how to prepare notes for this subject, because that is something very essential for this subject to remember and grasp this subject. And fourth and finally, I'll be talking about how to solve and approach the questions for this subject. With that being said, without much ado, let us get into the video. So in the very first section, we'll be talking about the resources. Now, for the entirety of community medicine in the entire country, there is one particular book which is used, and that is this book by Dr. K. Park. And this is the book of Preventive and Social Medicine. And this one particular book is used in the entire country. And this book is so boring, is so hefty, is so huge that even books of gynae and surgery falls less to this subject. When you open this book, you understand that this subject is not a subject alone, rather it's an amalgamation of all the other subjects. For example, you study about the vaccines and schedules, you study that in pediatrics as well. Similarly, if you talk about maternal care, you study that in obs and gynae as well. Having said this, we need to devise some strategy to read this book. I have read this book from cover to cover, from the first chapter to the last chapter, and that is why and how I have made a concise note to revise before the exam out of this book, and that is something very important. If you are starting out in your third year of MBBS, you should study this book to find out the important topics, the important points which are repeatedly asked in the exams, and then you should prepare a note of yourself and refer to that time and again, revise that time and again, and that is when and how you can actually get hold of this book in its entirety. Now, to grasp this subject, you can always refer to a referral book. Usually for other subjects, we refer to books which are of higher standard, but for this subjects in particular, we need to refer to a book which gets our job done. And for that, I would like to refer to the review book of PSM by Dr. Vivek Jain sir. And if you are someone enrolled into Cerebellum Academy, where Dr. Vivek Jain sir himself teaches the entire subject there, you can use their notes. Me being a Cerebellum Academy subscriber, I used these notes by Dr. Vivek Jain sir, and these notes are the best notes of PSM because these are concise in accordance to the textbook of Park, which is the gold standard book, and these are written in a very point-wise manner. If you use the review book, it is also of a similar kind, and that becomes very helpful during the exams while revising the important topics. And that is why I highly recommend you to get hold of the review book of Dr. Vivek Jain sir, or use his notes. You can get the PDF of the notes from anywhere, so you can get access of those and revise and read from them before the exams. Now, having talked about these resources, there is one another free resource that I would like to talk about, and that is Arpit's PSM YouTube channel. Every topic of the textbook of Park is dealt very meticulously in that particular channel. You can always refer to that as well. Even the videos are provided and attached with the notes of that particular video in that channel. I have never personally used that YouTube channel, but I have seen people using that and recommend that as well. So you can use that as well. You can go and check it out for yourself and then choose the best resource suitable for you. Now, let us just come to the next important topic, that is the important topics which need to be talked about, which you need to study in this subject of community medicine. For that, I would like to go to my screen and show you what are the important topics for community medicine. The first chapter that I would like to talk about are the communicable diseases. Of that, the most important are malaria, dengue, Japanese encephalitis, chikungunya, lymphatic filariasis, leishmaniasis, and with these, the most important national program is the National Vector-Borne Disease Control Program. Poliomyelitis, rabies, acute respiratory syndrome, and acute diarrheal diseases, these are very important because these you need to talk along with the IMNCI guidelines as well. Apart from that, measles, tuberculosis, leprosy, and HIV and AIDS are also very important topics. Now, communicable diseases is a very high yielding topic. This is one particular topic in the entirety of community medicine which you might find interest in studying. Having said this, you need to learn a lot of information in these chapters, so you need to make a concise note out of it and then study these particular topics. Next comes the very important topics, which is vaccines and cold chain. Now, this is something which is in accordance to the pediatrics. When you get to your final year of MBBS, you will be studying the similar things in pediatrics. Now, what is important in vaccines and cold chain is the national immunization schedule. The next is the cold chain. In cold chain, most important is instruments and equipments which are used, the freezers, the different kinds of freezers, cold boxes, etc. And the center's chronology, like what are the equipments present in which level of vaccine delivery. Like, for example, in sub-centers, the cold boxes are used, whereas in the state or regional centers, the walk-in refrigerators, walk-in freezers are present. That is how you should read these things, the cold chain of vaccine delivery. The next important thing are open vial policy, adverse effects following immunization, and vaccine vial monitoring. These are very important questions and very direct questions which are repeatedly asked in the subject of community medicine. The next important is epidemiology. Number one is the definition. Definition of epidemiology is something very important. The different types of epidemiological studies and the differences between them, such as cohort and case control study, cross-sectional and longitudinal study. And the most important thing which comes as a long questions answers is the steps of different kinds of studies, like descriptive study, case control study, cohort study, and the important steps of how you investigate an epidemic. Coming to the next topic, that is occupational disorder. Now, this is a very high yielding topic. The two most important things of these is the Factory Act and the ESI Act. These come as long questions or direct short questions as well. Apart from that comes sickness absenteeism, measures for health protection, and ergonomics. Now, coming to the non-communicable disease, the most important and the rising superstar of diseases is the cancers, the different kinds of cancers, and the most important being the breast cancer and cervical cancer. Now, why are these two cancers specifically important? Because these two cancers can be very well screened for and very well can be prevented, and that is why these two cancers are important from the viewpoint of community medicine as a subject. Now, talking about diabetes, hypertension, obesity, and blindness. Now, look, talking about communicable diseases actually gets hold of the importance of this subject. As the name of the subject suggests that it is a preventive and social medicine, so it usually talks about the diseases which are easily prevented or can be systematically prevented, and that is why the diseases which can be prevented are more important in this subject, like diabetes and hypertension and obesity. These are diseases which can be controlled, which can be prevented. So these are something which are very important in the view of this subject in particular. Now, coming to the screening of diseases, which is another primary work of the subject, that is the difference between screening and diagnostic tests is something very important. How is a screening test utilized? What are the different types of screening, and what are the criteria of a disease to be screened, and what is a very efficient and suitable screening test is something also talked about in this chapter, and these are very important, which come as direct long questions. Now, coming to disaster management, you need to know disaster cycle and triage as short note topics. The most important is disaster preparedness as BMOH. Now, this is a question which is repeated every year. Every year, some other disaster would be talked about, and you would be portrayed as a BMOH, and you need to talk about the steps, how you would actually prepare your area for that particular disaster. Now, coming to the topic of biostatistics. Look, this topic of biostatistics is something very important for NEET PG perspective, because if you see the notes of Dr. Vivek Jain sir or any institute whatsoever it might be, you would see that people have multiple topics being taught under this topic. But if you check your university questions, I'm pretty sure that this is not much important in view of your university questions. Practically, it is important, and for your practical exam also it is important. You would be asked to calculate different biostatistical measurements, and that is one particular thing that you should read and study in this particular chapter. That is, you need to learn the formulas of every biostatistical measurement tool very well. And the one question that might appear is sampling and different types of sampling, which is pretty well defined in a very short paragraph in the textbook of PART. You can go and learn it by heart. Now, coming to very important and practically very important topic, that is hospital waste management. If you have read microbiology in your second year of MBBS, then this becomes very easy, because this is the same topic which is being repeated in this subject, that is the color codings and the principles of biomedical waste management. Now, coming to a few important topics which come as long questions and short notes as well, that is health information and health care of the community. Health information, you need to know the definition of health information and the different sources of health information like sensors, registrations, SRS, sample registration systems, and etc. You would get an entire list, and I would provide you the notes as well. You can refer to that as well. Now, coming to the next important topic, that is the healthcare of the community. This happens to be the very important thing and crux of this entire subject, because it actually talks about the entire healthcare system of our country, how it works, how it functions, starting from the basic level to the advanced level, starting from the village level to the metropolitan city level, how it actually works. And that is something which is primarily the main attention of this subject, which you need to understand. So we need to know the levels of the subject, the primary healthcare definition, the elements of primary healthcare, and the principles of primary healthcare. And you need to know the composition of different levels of primary healthcare, that is at the level of village, sub-centers, PHCs, CHCs, health and wellness centers, and urban health centers as well. For example, in village, the main composition is of ASHA workers, Anganwadi workers, and the ANM nurses. Likewise, every other topic has got every different composition, which you need to know their strengths, what are the services provided in these areas and in these levels. That is something very important to know for this particular subject. Now, going to international health. Now, this is a very short topic, and every year one short note comes out of this topic, and that is something very important to talk about. Now, what is that? We need to know about WHO, UNICEF, Food and Agricultural Organization, International Labour Organization, and about the Red Cross Society. That is something very important to know. These are short notes, short topics, short functions that you need to learn by heart, and you would get some good marks out of it. Now, talking about health planning and management, you need to know the steps of health planning and management and what are the quantitative methods of management of healthcare. Talking about health communication, the types of communication and difference between health education and health propaganda, these are some important topics which are regularly asked. Talking about nutrition, this is a very important topic which is practically important and is something related to medicine as well. So you need to study this entire topic very seriously, and it is repeatedly asked as well. Now, what is it? The iodine deficiency disorders are very well asked, very repeatedly asked. Nutritional anemia, out of which anemia mukt Bharat is also asked. Now, this is one particular thing which is obstetrically very important because this forms a part of your obstetrics as well. Fluorine is a very important micronutrient which needs to be talked about. Vitamin A, and the important thing which is very prevalent in our country, that is malnutrition. We need to talk about nutritional status assessment and food toxicants, food additives and food fortification, their definitions, their examples and their importance as well. Going to the next section, that is water. It is something very repetitively asked. These are safe and wholesome water, its definition, its criterias, the water related disorders, the different types of water related disorders, purification of water and surveillance of water. Now, going to a very important topic, that is demography and family planning. Now, this is a very huge topic which is there present in the entire book of Park. Now, what are the important topics out of it we need to know? Number one is the demographic cycle, its steps, the population pyramid, how it varies from a developing country to a developed country, the different kinds of rates and ratios like total fertility rate, gross reproduction rate, net reproduction rate, all these are something very, very important. Talking about the contraceptive methods, while you study contraceptive methods, you need to study it under three headings. Number one are the advantages of each contraceptive method. Number two is the direction of use of these methods. And number three is disadvantages of each method. Now, talking about the maternal and child health problems and guidelines, we need to talk about the antenatal care, intranatal care and postnatal care. Now, these are very obstetrically significant, and that is why you need to study these points. These are something very, very important. Addition to these are school health services, which you need to study as well. Now, talking about the health and diseases, this is the last chapter which is usually present in the beginning of the textbook. Now, this entire chapter is important because it actually forms the basics of this entire subject. So let us now discuss how I have prepared my notes and how you can prepare your notes as well. I'm not going to go through the entirety of notes because these are like 100-200 pages long, which are very important for your exam. I'll provide these notes in the description box. You can check them out for yourself. But let me just get into the basics of how you can prepare your notes for community medicine. And I have prepared this entire note from the textbook of Park, and this is how you can do that. First and foremost thing is to know about the paper division. Look how I have actually written the paper divisions. Paper 1, these topics are important and these are the topics that are asked, and paper 2, these are the topics that are asked. Then I got two different topics. For example, if I just take a topic like malaria under communicable diseases, these are the things that I have talked about, the specific risk groups for malaria. Then I have written about the important definitions that are asked of malaria, like malaria control, malaria elimination, malaria eradication. What are the differences between these terms? Now, how I have got to know that these are the important topics? I have checked the previous year questions and I have then sorted out the important topics. Give a day to yourself, sort down the important topics which are repetitively asked in your exams, and I have also provided you the sheet, so make your notes accordingly. Then, talking about malaria, I have talked about the malaria cycle, the life cycle of the plasmodium. Then the next thing that I have talked about is the diagnosis. How do you diagnose? So usually if any disease is asked in community medicine, there are 2 to 3 things which are usually asked. Number 1 is how do you diagnose the disease? Number 2 is how do you manage the disease? And number 3 is how do you prevent the disease? Now, if you have divided this entire disease into these 3 sections, then you are very good to go. And this is how I have made my notes for malaria. Similarly, if I just take up another important topic like vaccines and cold chain, as I said, national immunization schedule is very important. I have written it in a particular format which is very easy for me to remember. I have written it like that. I have revised it multiple times, and then you are very good to go. Then I have talked about an important topic called as delayed immunization. How long can we delay the immunization of a particular vaccine? Then the important topic of cold chain. Look, if you just see the textbook of Park, then the cold chain equipments are dealt separately. Which levels and centers have what types of equipments are dealt separately. Now, if you see my notes, you would see that I have written the entire cold chain equipment in a sequential order as it is present. Then I have written in the side how they are present in which levels of the healthcare system. For example, walk-in freezers and walk-in coolers are present in the state and regional levels. The open valve policy is something very important. I have talked about what are the important points regarding policies, and this is how accordingly I have made an entire note of every topic that is important. I'm not going into the details of how you need to make a note. You have understood. Look, these are the steps of how you can actually make a note. Number one, take out your previous year questions and jot down the important points. And I have also given you a list of the important points. Refer to that. Number two, read the textbook of Perk in the first attempt and then make your notes accordingly. This might take you 2 to 3 months to prepare the entire notes, read every chapter, and after you have prepared that, you are way ahead of others because you don't need to refer to the book yet again. You can now refer to your own notes multiple times and you are good to go with this subject. Look, for this subject, you do not have an option other than mugging up. So you need to study accordingly how it goes. You need to make a note, revise that time and again, and then you are good to go for this subject. Now, after having talked about how you can prepare your notes, let me just talk about how to attempt the questions. Look, this subject is more of literature than medicine. So you need to write answers in terms of literature. And what literature demands is point-wise answer and the important points being highlighted. And that is how you should write these answers. Now, what can you do to make your answers beautiful for this subject? Number one is to read some pre-written answers, maybe refer to some quest books, and then write your answers accordingly. Number two is to practice writing the questions, how you can make the points beautiful. And third is, which is something very important, is to solve MCQs. If you solve the multiple choice questions for this particular subject, then you get hold of the minute details, the minute points for this subject, because this is one subject where the teacher demands that you speak what is written in the book itself. If you go for your viva examination, they would catch you for every full stop and comma and say that that is not there in the textbook of Park. And that is something which you can get hold of if you solve some MCQ questions, and that is what helps a lot. I know this subject is tough. This subject would require time to remember and memorize every important topic for this particular subject, but we need to approach it very strategically. I hope this video was helpful. If it was, hit the like button, subscribe to the channel, and share this video with whomever might find it helpful as well. And I repeat again, there are 2 PDFs present in the description box where you can download the important topics list, and secondly, you can also download my handwritten notes of this subject of community medicine. Thank you. See you in the next one. All the best.